You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker, and I'm the owner and founder here at Good Life Family Chiropractic, the only Max Living Health Center in the state of Nebraska. In fact, the only Max Living Health Center within the next 3.5 hours. And so if you're here in Omaha, if you're here in Lincoln, then we are your home for Max Living 5 Essential Healthcare. And my purpose every single morning here on KCRO and wherever you get your podcasts is to give you another message of hope, health, and wholeness. And the reason I do that is because there is no health, hope, or wholeness in our healthcare system today. In these United States, we do not have that hope. We live in fear. We live in fear of viruses. We live in fear of diseases. We live in fear of diagnoses. We live in fear of our doctors because we know that when we go to our doctor, all we're going to do is we're going to get a test, a diagnosis based off of the symptoms and signs found on that test, a drug, because we're the most medicated country in the world, and it's not even close. We take 74% of the world's prescription medications, 80% of the world's painkillers, and 90% of the world's psychotropic medications, because we're just that much crazier than the rest of the world. But here's the thing. The rest of the world wants to do it like we do. But here's what happens when you do it like we do. We spend more money on healthcare per capita and on average per person than any other country in the world. $11,000 per year last year that was spent on healthcare costs. $25,000 if you're over the age of 65. And that was spent mostly on medications and surgeries. It's not your average doctor's visit. It's not your well checks. It's when they give you that diagnosis. The average American ended up taking 10.8 medications last year. We have to do this differently. Why? Because when you look at the results of this, you see that we are underperforming all those countries in the world that want to be like us, that want to have a healthcare system that has access to the best professionals, that has access to the best facilities, that has access to the best research and the research funding, that has access to the best drugs. Nobody has it better than we do, and yet we're doing the worst. When you look at the World Health Organization report, where did we rank? Number 1 in spending, number 1 in drug care or drug intake, number 1 in facilities, 72nd overall when it comes to health. There are 71 other countries in the world that are healthier on us on average, even though we have the best access, even though we have the best doctors, even though we have all these things going on in our favor. They are doing better than us. Why is that? Because this system where all you do is look at symptoms, look at how you feel, is going to fail you. And too often I see this. I had 2 patients last week come through. They got their spines checked because they knew it was important, because their spouses were getting their spines checked because they had problems, they had symptoms. But when it came to them, because they were asymptomatic, because they didn't feel badly, they didn't ultimately trust what I was saying. In fact, in one gentleman, I found phase 4 arthritis in his spine, meaning that his bones had literally fused together because of the degeneration, osteoarthritis that was in there. I found a scoliosis in his low back. He says, "Why doesn't it hurt?" And I had to tell him that when you have that much arthritis, you still have to get lucky in order to feel bad. You still have to get lucky in order to feel bad. But even though he felt fine, we knew before he even came into the exam that his body wasn't functioning at 100%. Why? Because he had high blood pressure. The high blood pressure is a sign and symptom that his heart is malfunctioning, that his cardiovascular system is malfunctioning. And I said to him, "Look, Jerry, if all we do is continue to medicate that, does that actually make your heart healthier or your cardiovascular system healthier? Does it give it what it needs? Does it improve the function, or does all it do drop your blood pressure?" It decreases the blood pressure. That's it. But the cause of heart disease is not high blood pressure. High blood pressure is a sign of heart disease. You can die of a heart attack without high blood pressure. You can die of a heart attack without high cholesterol. These are just 2 signs that we've been able to correlate with people that have cardiovascular disease. We don't diagnose it based off of those things. We just see those as warning signs that you're going to die of cardiovascular disease. And right now in the US, that's the number 1 cause of death. 840,000 people died of cardiovascular disease last year. Guess what the number 1 most common symptom of cardiovascular disease was? The first symptom that people felt, 63% of the time, they expressed the symptom of cardiovascular disease by having a heart attack. On average, it took them 20 years of having that heart disease before they felt that, before they had that heart attack. And the survival rate for that first time heart attack was 50%. Literally a coin flip. If you wait until you feel cardiovascular disease, you're setting yourself up for failure. Same thing with cancer. Cancer was the number 2 cause of death in the United States last year. Over 600,000 deaths due to cancer. Between those two, we have almost 2/3 of all deaths that happened in the United States. Cancer, according to the Journal of Pharmaceutical Research, is considered a lifestyle preventable disease. 95% of the cases of cancer are due to lifestyle factors. Less than 5% are due to genetics, and that study didn't account for epigenetics at all, meaning that the environment affecting the genes and how it expresses itself was not accounted for, meaning that cancer is not just mostly lifestyle preventable, it's almost always lifestyle preventable. And so what that means is that people are lifestyling their way into cancer. If you wait until you feel cancer, however, you've waited until you've had it for 20 years. We know that on average, cancer is lethal at 10 years. And so we don't want to wait. We go for colonoscopies, PET scans, mammograms, CT scans, MRIs, prostate checks, all these tests, even by our best tests. It still takes cancer growing 10 years inside your body for it to become detectable. 8 years before it's detectable. If you wait until you feel it, it's too late. If you wait until we diagnose it in the healthcare system, it's too late. We have to take action now. The definition of health has absolutely nothing to do with your symptoms. Yes, I don't want you to have back pain. Yes, I don't want you to have headaches. Yes, I don't want you to have high blood pressure. But most of all, I want you to have true health. True health is a state of 100% optimal function and healing, according to Dorland's Medical Dictionary. According to the World Health Organization, that function and healing has to go across physical, mental, emotional parts of your life as well. And so if you're not expressing function, if your body's not able to heal, that's a sign of disease building in your body. That's a sign that you are already sick, that you are not healthy. But for most people to feel that symptom, it takes a decrease in function of 40%. You can be 1% deficient and be unhealthy. But if you're waiting until you feel a symptom to do anything about your health, you are setting yourself up for failure. I'm sorry, there's no other way to get around this than saying that we're thinking about this all wrong. Remember Romans 12:2, it says, do not conform any longer to the patterns of this world, but be transformed by the renewing of your mind. That's where health starts, is in the mind. Then knowing where it comes from. Function is controlled by the central nervous system. For your heart to beat, for your lungs to breathe, for a cut on your leg to heal, a signal has to go from your brain, run down your spinal cord and out the nerves to every organ, cell, and tissue in your body. It doesn't happen any other way. You impede that signal even slightly, you start to malfunction. That malfunction leads to sickness and disease and an early death. We don't want that to happen. God didn't want that to happen. So he surrounded and protect that system that controls your function, the central nervous system, with bone. The skull surrounds and protects your brain. The spinal cord and each individual nerve are surrounded and protected by your spinal column and each individual vertebra. When that's in normal alignment, straight from the front with 345-degree curves from the side, then there can be no pressure damage on your nervous system. So I learned this in school, right? I learned how important this was. So I went and I got some x-rays in the student clinic, and I had my student practitioner go through those x-rays with me and showed me where problems were. And, so I asked, what do we expect to get this fixed? And he said, well, I don't know. We're just going to adjust it and see how you respond. And so I went to the professor and said, well, my clinician, I understand he's a student. He doesn't understand how this is going to get fixed or the process or everything that's going on. He's like, yeah, chiropractors aren't actually trained in how to correct the spine. We just move the spine so that it improves the overall function of joint health, which actually relates back to how the nerves function better. It's like, okay, well, that sounds good, but all this research is showing that if I don't have the normal curves in my neck, if I have a scoliosis in my spine, that it actually decreases my life expectancy regardless of movement. It's like, yeah, less than 1% of the chiropractors in the world do that. I'm like, okay, I'm going to go there. So I went down the street. I found a Max Living office 30 minutes away from where I went to school. Now, granted, being in school is not the most convenient time when you're getting your doctorate to travel. Round trip, over an hour, half an hour in the office. I get it. People coming from Omaha all the time, they complain about the commute, but it is what it is. You either have to get it done or you just suffer the ramifications, suffer the consequences. This is why I teach my kids. Everything in life is a choice. If I was to get cancer right now, I would travel to Europe to see the best doctors in the world because they address cause of cancer and don't just medicate me to try to decrease the symptoms and signs of that cancer, addressing the malfunction. And so, yeah, I go through this process and he shows me where my spine is off and how it's out of alignment. He shows me the process to get correction. And I go through that process and my spine improves. And guess what? My health improves. And guess what? My function improves. And guess what? I'm healthy. That's how you get there. You go through the process that it takes to get that correction. What does that process involve? It involves daily spinal care. Taking care of your spine at home on a daily basis, warming up your spine, giving it the motion it needs, giving it the life it needs, and giving it the exercises it needs in order to stay healthy. Just like you brush your teeth every day, you should be taking care of your spine every day. If you're not, your spine's decaying and rotting out from under you. Secondly, it takes an environment where I'm going and I'm getting regularly checked and adjusted in a corrective model by a chiropractor to maintain that spine in normal position. If you're just getting cracked when it feels bad, you're getting bad chiropractic care. I'm sorry. If your chiropractor tells you to come back just when it hurts, you're getting bad chiropractic care. No matter how good those adjustments are, no matter how good those adjustments feel, they may be an excellent adjuster, but they're a bad chiropractor because they're not assessing you and advising you based off of the health and function of your nervous system. Thirdly, we need an environment that supports the health of the nervous system through nutrition and fitness and detox. We call that a 5 essentials environment because you're taking that mindset, knowing that the nervous system controls health, that the intelligence that God put inside of us controls all health and function. We're exiting the medical model, declining to participate in a system that only addresses symptoms because it's a lie. It is a lie. When you only address symptoms and then you tell someone that they're healthy, you are literally lying to them. I have patients that come in and are told that they have a quote unquote mild scoliosis. Guess what mild scoliosis does to your health? It decreases your life expectancy and life quality by the same amount as having type 2 diabetes, almost 20 years on average. That's a lie. And we will not stand for lies in this practice. We will not stand for lies as believers in Christ, the author and perfecter of not just our faith, but the truth, capital T, capital R, capital U, capital T, capital H. If you are participating in this system, you are participating in a lie. And I understand that there's doctors and nurses and people that work in this system, and that's okay because there's a time and a place for this system, and the emergency care that we get in this country is better than nowhere else. But if you have not exited that thought process and started participating in this chiropractic cause and effect thought process, then you are participating in a lie and you are not expressing health and life and vitality. And I'm sorry that I have to draw this line this way, but it needs to be said. I'm Dr. Jake Tucker. If you need me, I'm here in my office on the south side of Lincoln, 531-289-7100. I'll see you again tomorrow for another episode of Max Living Radio and Ask Dr. Jake.